Okay, so my goal before creating my map was not to spend more time than I was asking you to spend. But since then, I've added a few more touches. So in all fairness, there's two differences between mine and yours. First, time, and second, my research has just been in health literacy for the past 3 years or more. So that would lend itself to a somewhat deeper understanding of those concepts. I've not attempted a digital version. I use Canva for a lot of presentations and posters, so I may give that a shot if I feel the need to do that. So my topic is anti-fat bias. Anti-fat bias leads people to associate individuals who are considered overweight or obese with negative personality traits, such as lacking willpower, lazy, gluttonous, stupid, incompetent, or unmotivated. This bias is not restricted to clinically obese individuals. I'm not even addressing medically obese in this presentation. And since the definitions of overweight and obese are arbitrary and have become social constructs beyond what these terms mean medically, I'll be using the term fat or person who is fat throughout this presentation. Weight bias has been reported in the literature for nearly 3 decades. A 2021 systematic review out of Curtin University in Australia was of 41 studies looking at medical professionals, doctors, nurses, dietitians, and a number of others, and confirmed that they hold implicit or explicit weight biased attitudes towards people who are fat. This study revealed that weight bias exhibited in healthcare providers negatively affects the provision of healthcare and is associated with less use of healthcare services by those clients, which consequently leads to treatment avoidance. We talked about trust being a huge factor in compliance earlier in the semester. These patients do not feel healthcare providers are attentive to their health concerns or spend sufficient time listening to them during a consultation, since these providers assume all their problems are associated with their weight, and most often they are not. And when they do, it is often met with patronizing or disrespectful language. Compared with older healthcare providers, one study found that younger healthcare providers exhibited greater weight bias toward patients who are fat. Weight-biased attitudes have also been identified in university health science majors. These authors recommend the most effective way to reduce weight bias in healthcare providers may be to increase education of obesity as a disease, such as alcoholism is recognized for what it actually is, to ensure that future healthcare providers develop greater awareness and understanding of the influence of weight bias and their provision of care and how weight bias may negatively influence the patient-provider relationship. Another study from 2018 out of Boston University reported that weight stigma is particularly prevalent among medical students with obesity, reporting high levels of alcohol and substance use to cope with internalized weight stigma they experience among their peers. And lastly, the couple of related concepts would be trust, which I've already talked about here. So here's trust here on my concept map. I equate this to weathering, which we talked about during our health equity discussion in other minoritized populations, where constant exposure to racist behaviors, for instance, contribute to physiological impacts like high blood pressure, anxiety, digestive issues, which is contradictory and exacerbated by the assumption that those health issues are somehow self-inflicted through lifestyle choices. The most effective and ethical approach should be to aim behavior and attitude change in those who stigmatize rather than towards the targets of that stigma. Just like in other areas of systemic harm, the burden should be placed on the victim, should not be placed on the victims of that marginalization. And this applies to really anyone who can fall into a category of otherness or otherwise known as encompassing physical or mental characteristics outside of the status quo. And then prior knowledge, prior experiences, education, all of those can impact how we view, communicate, and treat those around us. We talked about community and echo chambers. If we're constantly seeing memes and TikToks portraying fat people in unbecoming situations, it lends itself to continuing that bias towards them. Thank you.